I've been away for a bit, so I'm really sorry because I was doing some regular live feeds. I've been away with Stephanie Beeson, writing or starting our book on hypermobility. So today I was teaching in the studio, and one of my other teachers had a student come in who'd had a bit of back pain. Anyway, she was looking at her on the floor and I could see she was rotated. So I'm going to give you some top tips today. This will make more sense to the Pilates therapists out there, so well done all of you. But this is for everybody. This is for all the Pilates teachers and anybody who gets somebody in with maybe even sciatic pain or bits of back pain. So I've got Alex here, who is very kindly my body today. He's one of my Pilates therapists at the centre. So sometimes you can see your clients, and Sam was looking at her client laying face down, and you can see that when they lie face down, maybe they're a bit rotated. So you'll often see one side sticking up at you, and that would usually indicate that the side of the pelvis was in a posterior rotated position. So I'm going to have Alex lie facing the camera for a bit. And if you're a Pilates therapist, and you can assess that, because all of our Pilates therapists should be able to assess through some of the screens they get on our course, whether it's in a posterior tilt. I'm going to give you a little thing that you can do, or you can send home with your clients. Most people who get sciatic nerve pain, not all, but if you know that if you're a Pilates teacher and your client comes in and they've been diagnosed with maybe a bulging disc, it's almost always a posterior tilt on that side. And if you ever attend any of our workshops, we do pelvis and spine and hip and pelvis, we can explain why that is. So in a case like that, when your leg hangs, so if I was to be standing off a curb and the leg hangs, it pulls that bone forward. So in order to get that bone to go back into a good position and take that pelvis back into a good position, which is almost the equivalent of an extension. So if you think, generally speaking, Pilates teachers are taught, or physios, you've got the McKenzie technique, are taught to take their clients into extension when they've got disc issues. So you can take their foot under a ball, and it brings me back to when I first did my Pilates training, and I had my case study come in, and she had a horrific back episode, and I put her leg on a ball and I had her reach her leg on the ball long. And what was interesting is she got much better, but I didn't know why. So the reason why is because as she reached that ball, or her leg on the ball, so you're going to lengthen, it not only opened up her space here, but it was going to draw the innominate bone into an anterior position and then relax back. And sometimes it just gets stuck in a posterior position, and you need to just get the back moving this way. And then release. How does that feel, Alex?
That's good, yeah.
Yeah, and just reach. And release. Good. And reach, and you're letting that come into an anterior tilt. So this is a great take-home exercise for people. Most of the people who end up with disky issues as well will have tightness in their QL and things like that. So this lengthens, it opens the space while taking it into the correct position, so offloading the problem. So that is my top tip for this week from the Pilates Therapy Centre. I hope you all take that home and use it. Bye.